July to end, 1944 underground hospital cave, near Cherbourg, France. The white medical coat hung loosely from her shoulders as Dr. Schwestern stepped out of the cavernous tunnel, hands lifted in surrender, blinking hard against the harsh daylight she had not seen in days. The Americans cannot possibly have the medical supplies they claim. This must be propaganda to break our morale. Those were the words she had spoken to her fellow nurses only hours earlier. Inside the hospital cave, carved deep beneath the fortifications near Cherbourg, now as reality unfolded before her, she realized those words would be the first of many assumptions soon to collapse. Behind her, 8 other German army nurses filed out into the sunlight, among the very first captured by American forces. During the invasion of France, they had spent the final days of the siege treating wounded Wehrmacht soldiers by candlelight, rationing their last vials of morphine, boiling and reboiling blood-soaked bandages in desperate attempts to reuse them. None of them knew that within hours they would witness medical capabilities that contradicted everything they had been taught about American weakness and German superiority. The 9 nurses, captured after triaging casualties in conditions that resembled medieval surgery more than modern medicine, were about to experience a medical system so advanced, so abundantly supplied that it would shatter not just their medical understanding, but their anti-ideological foundation. Colonel Rickert Johnson, commanding officer of the 45th Evacuation Hospital at Lamb, studied them with curiosity rather than hostility. Enemy medical personnel, yet fellow healers. Within days, these nurses would be returned to German lines under Geneva Convention protocols. A total of 16 German nurses would be exchanged on July 2nd and July 9th. But first, they would witness American medicine in 1944 vacations. They had only heard rumors about surgical techniques beyond their training. The psychological impact would last far longer than their brief captivity. The unraveling had begun over a year earlier on May 13, 1943, in the scorching heat of Tunisia. General Hans Jürgen Von's surrender included not just combat troops, but thousands of medical personnel, doctors, orderlies, and among them DRK-Schwestern, German Red Cross nurses who had served with Rams Africa Corps through 2 years of desert warfare. Among the captured was DRK-Schwestern Ilse Schulz, who had received the Iron Cross Secondas in April 1943, one of fewer than 20 women ever to receive this decoration during the war. Her colleague, Dr. Schwester Grete Fock, also decorated with the Iron Cross in April 1943, kept careful observations that would later be discovered in German military archives. The Americans throw away more medical supplies in a day than we received in a month. They have medicines we have only heard about. The scale of the surrender was staggering. Between 250,000 and 275,000 Axis troops, including medical staff from elite divisions like the 21st Street Panzer, the 15th Panzer Division, and the 19th Light Division, while most captured medical personnel were male doctors and orderlies. The nurses among them would experience a particularly profound ideological shock. The American processing followed strict Geneva Convention protocols with remarkable efficiency. At collection points in Tunis, American medical officers sorted captured medical personnel within hours. Those needed to treat German wounded were retained. Others were marked for evacuation. Every captured nurse received a medical examination using equipment that had become scarce in the Africa Corps. WWII in 1943. The first groups of captured German medical personnel were boarding Liberty ships for transport to the United States. These mass-produced vessels themselves synthetic German propaganda about American industrial weakness. The ship's medical facilities exceeded any Thingerman nurses had seen in Romoland. Operating theaters with consistent electric lighting, functional X-ray machines, and refrigerated storage were standard. Most striking were the blood plasma supplies, properly typed and stored units that could be administered safely. Unlike the risky direct transfusions German forces attempted in field conditions, the Two crossing revealed American medical abundance daily. Sulfur powder rationed by the grain and German forces used liberally. Bandages were disposed after single use. German medical personnel who had survived on minimal rations watched American medics discard uneaten food portions. Waste hat would have been unthinkable in Thievermacht. Ships carrying German medical personnel docked at ports from Norfolk to New York. Their first glimpse of America contradicted years of propaganda about a nation supposedly weakened by economic depression. At Norfolk Naval Base, medical processing included comprehensive examinations for captured personnel. Dental work was performed, infections were treated, and those needing corrective lenses received them. This level of care exceeded what was available to German civilians. Their journey inland provided continuation. City after city displayed a limity in hospitals. In Richmond, the Medical College of Virginia complex was visible from the trains. In Philadelphia, Pennsylvania, hospital-sipsing structure could be seen. Every urban center possessed medical facilities surpassing those in major German cities. At a Washington, D.C. stop, American Red Cross volunteers boarded to distribute packages to German POWs. Toiletries, cigarettes, chocolate, writing materials. German nurses indoctrinated in racial struggle ideology struggled to comprehend this kindness toward enemies. Camp Opelika, Alabama opened in September 1942 and received its first Afrika Korps medical personnel in June 1943. The camp hospital became a unequivalent, where German medical staff trained in Nazi racial medicine worked alongside Americans practicing clinical medicine. The dual staff system followed Geneva Convention requirements. American medical officers supervised while German personnel provided direct patient care. This created an unprecedented situation. Enemy medical staff operating within the American military medical system. The facilities astounded German nurses. Operating rooms contained equipment they knew only from textbooks. Electrocauterization, adjustable surgiclets, rapid sterilization autoclaves. The pharmacy held hundreds of medications in climate-controlled storage with expiration dates years away. On July 21, 1944, Glennan General Hospital in Okmulgee, Oklahoma became a German prisoner of war General Hospital No. 1 with 1690 beds, staffed by parallel American and German medical teams. Colonel Henry W. Misch implemented something unthinkable in Nazi Germany. Integrated medical teams sharing knowledge across enemies. German nurses from the NSA Schaftwa had been taught American medicine was weak and corrupted, discovered a system based on rigorous scientific method. Most challenging to their worldview were the African American nurses assigned to P wards, a result of this military segregation that relegated black nurses to treating enemy prisoners rather than white American soldiers. German nurses observed, these are professionals providing skilled care that contradicted every rational assumption they had been taught. Nothing demonstrated American medical superiority more dramatically than penicillin. In 1943, the United States produced 21 billion units. By 1945, production reached 6.8 trillion units. German medical personnel operating without effective antibiotics witnessed routine use of this miracle drug. At Camp Forston, Tennessee, which housed German Sosand, included extensive medical facilities. German nurses observed transformation they considered impossible. Infections that may ascertain death in German field hospitals cleared within days. Where German surgeons would have amputated, American doctors saved limbs. American medical officers, many civilian doctors in uniform, shared knowledge freely. Openness toward enemies contradicted deverage. German medical personnel had been taught about warfare and medicine. The American blood plasma system represented another leap beyond. German capabilities, proper typing, cross-matching, and preservation prevented the often fatal reactions from direct transfusions still by German forces. At facilities like the 21st General Hospital at Travenol, France, where captured German staff worked from December 1944, the blood supply system operated with industrial efficiency. Plasma stored for months, transported thousands of miles, administered without knowing blood types. Capabilities that German medicine had achieved. German nurses trained in the Schwestern had learned that medicine served racial improvement. Their education include unraisen heredity and racial studies, teaching that weak patients should be eliminated to strengthen the race. At facilities like 12th Field Hospital's 30,000-bed population, they witnessed the opposite. American medical staff treated German prisoners identically to American wounded. Enemies received the same scarce medications, surgical procedures, and nursing care as allied soldiers. This fundamental difference, medicine as universal healing versus racial tool, began demolishing their ideological framework. Christmas 1943 delivered profound psychological impact. American organizations sent 500,000 packages to German POWs. Each contained wardemelcheries, coffee, chocolate, cigarettes, soap. At Camp Alva, Oklahoma, designated for Africa Corps personnel, local churches sang German carols. Boy Scouts delivered handmade cards. Families with sons fighting in Europe sent home amatriates. The Christmas feast, turkey, ham, vegetables, desserts exceeded anything German forces had seen in years. German nurses documented their confusion, enemies showing Christianity while their own propaganda preached hatred. By 1944, the Special Projects Division implemented TECMP's education programs. German nurses attended lectures at institutions like the University of Nebraska, ME. Lieutenant Colonel Dorothy Whitman at Camp Opelika arranged for the German nurses to observe American nursing practices and experience designed not only to educate them, but to challenge their assumptions. She emphasized meticulous documentation, patient advocacy, and the idea that technical skill meant little without ethical responsibility. Throughout their captivity, the sheer abundance of American medical resources stunned the German nurses. U.S. hospitals discarded medications that were only slightly expired drugs Germany couldn't manufacture at all. Surgical instruments were replaced at the first sign of wear, instead of being endlessly repaired and reused. To the nurses, this apparent wastefulness revealed a truth that contradicted everything Nazi propaganda had taught them. America did not need to conquer territory for resources. It created its own through industry, innovation, and scale. Germany fought desperate battles for materials that America produced in quantities so vast they were taken for granted. Even more shocking was the difference in professional culture. American nursing practice undercut the very foundations of German medical identity. Under Nazi hierarchy, obedience was absolute. Orders were followed, not questioned. But American nurses operated as independent thinkers with genuine professional autonomy. They could question doctors' orders, sub-gestalternatives, make independent decisions within their scope. This professional mode, known in German nursing, represented a complete reimagining of your role. Captain Helen Morrison at Glennan explained, "You're responsible for patient outcomes. If something's wrong, speak up regardless of hierarchy." This empowerment transformed their understanding of nursing itself. African American medical personnel's presence created profound cognitive essence. German nurses worked under black professionals demonstrating their knowledge and skills. Lieutenant Elenina Powell at Camp Florence, Arizona supervised German nursing staff with professionalism that contradicted racial propaganda. When she corrected techniques or taught procedures, German nurses confronted the falsity of their racial education. Irony wasn't lost. American segregation assigned black nurses to enemy prisoners. Yet, even this flawed system produced better outcomes than Nazi-racial medicine. After Italy's September 1943 surrender, cooperating Italian medical personnel received better treatment. German nurse watched former allies gain privilege while they remained restricted. This pragmatic approach, judging current cooperation over past allegiance, contrasted with rigid Nazi ideology. Italian nurses worked freely while Germans, maintaining Nazi beliefs, stayed under guard, despite prisoner status. German nurses received medical education exceeding their homeland training. American officers taught new techniques, medications, and equipment operation freely. Knowledge was shared without restriction. Burn treatments from Pacific experience, surgical innovations from European combat, all taught autonomy personnel. German nurses documented everything owing their return to a destroyed nation in medical expertise. As war ended in May 1945, American authorities prepared German medical personnel for repatriation through comprehensive training. Courses covered public health, epidemic control, emergency medicine. Skills for building Germany's medical system. They learned water purification, mass vaccination, malnutrition treatment. Colonel Richard Stevens told them, "You're returning to massive medical needs. This knowledge is our investment." In democratic Germany, training included establishing clinics with minimal resources, training auxiliary personnel, implementing public health measures. German nurses received certificate testicum their American training, credentials valuable in occupied Germany. German nurses returning between 1945 to 1946 found 60% of German hospitals destroyed. They brought not just American techniques, but fundamentally different medical philosophy. Former POWs established nursing schools emphasizing patient advocacy. Ideology. American protocols were implemented in rebuilt facilities. Blood banking systems copied from American models. Systematic antibiotic use following American guidelines. By November 1945, with minimal American medical personnel remaining in Germany, these American-trained Germans became essential to public health maintenance. The influence extended beyond immediate test war years. By 1950, many German nursing schools were led by former POWs. They introduced concepts learned in American camps. Nursing diagnosis, patient advocacy, continuous education. German pharmaceutical companies adopted quality standards observed in captivity. Hospitals reorganized following American models witnessed firsthand. The transformation from ideological to scientific medicine became permanent. The numbers reveal the scope. Total German PSWs in US 371,683, UCL facilities with German staff over 200. Documented medical education whores 100,000 plus. Medical procedures performed hundreds of thousands. Nursing schools established by returnees 15 plus documented. Hospitals reorganized on American models, dozens in US zone. Each trained nurse influenced dozens of colleagues. Each reformed hospital treated thousands. The ripple effects multiplied exponentially. In 1995, surviving German nurses who experienced American captivity drafted a statement. "We served the Nazi regime and became American prisoners. We witnessed that medicine, corrupted by ideology, becomes death's instrument, while a medicine based on science and compassion serves life. Americans showed us abundance beyond imagination, medications, technology, resources. More importantly, they demonstrated medicine without hatred. They treated enemies as patients deserving equal care. We returned carrying more than medical knowledge. We brought understanding that transcends nationality and ideology to future medical professionals. Never let medicine serve ideology over healing." American doctors and nurses taught us this by treating enemies as humans deserving compassion. We arrived as prisoners. We left as witnesses to medicine's true purpose. The transformation of German nurses in American captivity represents one of World War I's most successful ideological conversions. They witnessed not just technological superiority, but medicine's fundamental purpose: healing without discrimination. Their journey from Nazi medical servants to scientific medicine advocates demonstrates experiences power over propaganda. Daily exposure to American medical practice accomplished what for Sekelent complete ideologische. The 9 nurses emerging from Cherbourg's underground hospital on July 2 and 1944 presented thousands who would experience this revelation. They entered captivity believing in German superiority. They left understanding that medical excellence comes from science, resources, and universal compassion. This was America's greatest medical victory, demonstrating through daily practice that humanitarian medicine triumphs over ideological medicine. German nurses weren't just captured, they were converted through witness to medicine's true purpose. Their conversion laid foundations for post-war German medicine's reconstruction on humanitarian rather than racial principles. In their transformation lay proof that even the most indoctrinated minds can change when confronted with undeniable evidence of a better way. The German nurses captured by American forces discovered that their enemies possessed not just superior resources but superior medical philosophy. They had been taught medicine, served racial ideology. They learned medicine, service humanity. That lesson learned in American captivity would reshape German medicine for generations. Their story stands as testament. Medicine based on science and compassion will always defeat medicine corrupted, bigoted and ideology. The captured became witnesses. The enemies became colleagues. And through their transformation, listen returned to its proper purpose. Healing without borders. Science without prejudice. Compassion for all who suffer.